looking at the progression in the patients. We had a really good shot on goal. The problem was we were dealing with a neuronal disease in which we would have to administer directly to the CNS.
We interacted with a ton of experts on how would you deliver this. This is really novel. Like, not many drugs go right directly into the CSF and through a little hole in the skull. Once we realized that we had to kind of use a whole bunch of different devices and put them all together, then it became, how do you make sure that all the pieces fit together at some point?
It's a paradigm that ordinary drug developers have really tried to avoid. But given the severity of the disease, and given the fact that when you give the drug straight into the brain, it gets everywhere throughout the brain, we were able to get ethics approval and regulatory approval fairly quickly.
It's been a lot of work, yeah.
The route of administration here is pretty heroic. We are putting a catheter into the middle of their brain, and we infuse drug in every 14 days.
We took two pretty well-known medical approaches. One is enzyme replacement therapy. That's one. We know that really well. The other is this delivery to the brain ventricles, ICV delivery. Both of those had been done for years, but never together. That's one big first.
And that's what we do here at BioMarin. We innovate to help these patients because these patients otherwise would go unnoticed.